What kind of speech problems patients have with Parkinson's disease? Speech problems are common in patients with Parkinson's disease, especially as the disease progresses. People with Parkinson's disease are sometimes asked by other people to repeat themselves, and other people may have difficulty understanding them. This causes emotional stress in these patients. They may have difficulty during conversations due to new changes in their sleep, their low morale, and also reduced motivation to communicate, and depression. They feel much more negative. The communication difficulties affect these people's social skills, lifestyle, and emotional well-being. Speech problems do interfere with their daily activities, such as visiting a bank teller, or asking assistance from a store clerk, or doing other activities in an independent fashion. Therefore, sometimes these patients become reluctant to participate in social engagements, such as family gatherings or dinners, and they start feeling they are isolated. The speech problems could be reduced loudness of speech or softness of speech, and they lose the variability in the tone of speech which a normal person has it. So their speech is called the monotonous speech. Sometimes their speech could be hoarse, breathy, and imprecise, and they may have short rushes of speech in Parkinson's disease. Furthermore, sometimes the speech in these patients could sound more nasal. Sometimes they could have a vocal tremor, and various therapies or courses such as Lee Silverman voice training are helpful to improve their speech. These are well-established programs, and they are used by many speech pathologists, and these programs help in increasing the voice volume, improving the ability to perceive effort, and getting high effort from the patients. Treating intensively about 4 to 5 times a week for 1 month is helpful, and the changes in the treatment could be measured as the course of this treatment goes on. The other things like pitch limiting voice training is an addition to LSVT, and it also helps patients to focus their pitch maintenance. This encourages patients to speak in a low voice to prevent the strained or pressured voice. This is a variation of LSVT and is known as pitch limiting voice treatment. The group interventions are done with a number of patients together rather than one-to-one therapy. And the group settings help people with Parkinson's disease to practice taking turns, engaging in a discussion, dialogue, arguments, and engaging with more than one person, asking questions and answering in front of other people in the group. And these patients can learn, they can observe, and they can evaluate each other. And they can also practice these speech therapies together in a supportive fashion. There are some limitations to group therapy because the nature of the group settings, and the therapist may not be able to give a direct feedback to each and every individual patients. However, patients do receive evaluations from other group members. Some of the suggestions which can improve communication in people who have speech problems in Parkinson's disease beside speech therapy include being aware of breathing. Also, before speaking, breathing in fully and not running out of the air before you finish the sentence. Keeping the rate of the speech slow and even. Forcing the lips and jaw to work hard as you pronounce words. Making an eye contact with your listener, and establishing a topic before beginning a conversation. Also, concentrating or finishing the sound of each word before starting the next. having your family and friends tell when your voice drops also helpful. And also talking about this problem with family members and friends makes them understand. Reducing the background noise, turning down volume of TV or radio is also helpful for other people to listen to you. And also not relying on other people to speak for you, but you should try to speak for yourself, even if the other people want to speak for you, because when you speak for yourself, it helps you to talk for you. And when you feel tired, of course you can ask for help, but you should try to keep your head up and straight, and you should speak in the phone piece directly. And also you should keep your voice warm up. You should clear your mouth of saliva regularly while you are talking. Daily deep breathing and relaxation exercises and exercises of speech muscles, jaw and lips are also very helpful. Giving more group speeches while keeping your head in upright fashion is also very helpful. Standing upright as much as possible helps to maintain a good posture and improves your voice as well. Also, when you're talking, exaggerate the loudness of your voice. And remember that the shorter sentences are easier to understand than longer sentences. When using longer sentences, you should give a pause to help listener to understand what you're trying to say. You should also encourage your family and friends to let you know when you have difficulty with the speech so that they can help you and they can provide you a feedback. This feedback helps you to make a conscious effort to improve your speech. Also, face the speaker directly and give them your full attention. And the most important of all is absolutely relax when you're speaking to people. These strategies are very successful, and there are many other devices which can help, such as voice amplifier or keeping a notebook and a pen to write down keywords if writing is easy for you, but if writing is difficult, then you can use whiteboards, etc. So these strategies help you to communicate to other people, which is an essential thing of day-to-day life.